Okay, let's talk about something that's pretty much every dog owner's nightmare. You're out for a walk or cleaning up the yard, and you see it, blood in your dog's stool. I know, your heart just drops, right? Your mind starts racing. But before you panic, let's just take a deep breath. We're going to break down what this actually means nice and clear.
So, what does it mean? Well, here's the thing. Blood itself isn't the disease. It's a signpost. It's a symptom that can point to a whole range of things, from something really minor to a serious medical emergency. The trick is knowing how to spot the difference, and that's exactly what we're going to help you do today.
So, here's our game plan. We've got 4 key things to cover. First up, we're going to decode the colors. What the blood actually looks like tells you a ton. Then, we'll get into all the possible causes. After that, and this is crucial, we'll cover the emergency red flags that mean you need to get to a vet like now. And finally, we'll walk you through what the vet is probably going to do.
All right, let's jump right into section 1. This is probably the most important thing you can do at home. Just observe. The color and consistency of the blood is the #1 clue you can give your vet to help them figure out what's going on.
Okay, so there are 2 big words on this slide, but don't worry, they're actually pretty simple once you see them. On one side, you have hematochezia. That's the bright, fresh-looking red blood. And on the other, you have melena, which is dark, black, and tarry. They couldn't look more different, and that's because they come from completely different places in your dog's body.
Let's talk about hematochezia first. This is the bright red stuff. You might see it streaked on the poop, mixed in, or maybe even just a few drops. Because it's bright red, it's fresh. It tells us the problem is happening near the exit ramp of the digestive system, the colon or the rectum. The blood didn't have to travel far, so it hasn't been digested.
Now, melena, this one is tricky. It's the complete opposite. It doesn't even really look like blood, right? It's black, sticky, kind of like tar. Some people say it looks like coffee grounds. And that's because this blood has been digested. It's taken a long journey all the way from the upper part of the GI tract. So when you see this, you know the bleeding is happening way up high, like in the stomach or the small intestine. Okay, so now that we know how to tell the difference between the two, what could actually be causing them? Let's get into the possible culprits, because the lists for each are pretty different.
This table lays it out really nicely. For the bright red blood, hematochezia, the common causes are often things that are manageable. Like an inflamed colon, what they call colitis, maybe from stress or eating something weird. Could be parasites or even anal gland problems. More serious? Sure. It could be a foreign object that's causing a scrape on its way out, or even rectal tumors. Now, for melena, the black stool, the causes here tend to be a bit more serious right off the bat. It could be stomach ulcers, maybe from certain medications. A weird one people forget is bad dental disease, where they're swallowing blood from their mouth. And the really scary stuff includes internal damage from something they ate, tumors, or clotting problems, which can happen if a dog gets into something awful like rat poison.
All right, we've talked about what it is and what might cause it. But now for the most important part. When is this an absolute drop everything, run to the vet emergency? Let's get real clear on this.
I want to be crystal clear about this. Anytime you see melena, that black, tarry stool, it's an emergency. Full stop. While a tiny streak of red blood might be something you can call your vet about, melena is different. Don't wait and see. It often means there's significant internal bleeding, and you need to call your vet or an emergency clinic immediately.
And hey, it's not just about the poop. You have to look at your dog's whole vibe. Are they also vomiting? Are they super tired, like can't even get up, lethargic? Check their gums. Lift their lip. Are the gums pale or white instead of a nice, healthy pink? Is their belly swollen or hard, or do they yelp when you touch it? And of course, is there just a lot of blood? Any of these signs paired with bloody stool means you go now.
There's one specific, nasty condition I have to mention, and it's called AHDS. This thing comes on fast. We're talking sudden vomiting and this really distinct bloody diarrhea that people often say looks like raspberry jelly. The real danger here is how quickly a dog can get dehydrated and go into shock. We're talking hours, not days. It is a true emergency.
And to give you an idea of how serious this gets, vets will run a blood test called a PCV. Basically, it measures how thick the blood is getting because of fluid loss. Normal is somewhere under 55%. But if that number creeps over 55%, it's a giant red flag. It means severe dehydration is setting in, and that dog needs aggressive IV fluids immediately to prevent their organs from shutting down.
Okay, so you've seen a red flag, you've called the vet, and you're on your way. I know this is a super stressful moment, but let's walk through what's likely going to happen so you can feel a little more prepared and in control.
The vet's first job is to play detective.
They need to find the root cause of the bleeding because you can't fix a problem until you know what it is, right? So they're going to start a pretty systematic process to figure it all out.
It's usually a 4-step deal. Step 1, a full physical exam, and they'll ask you a ton of questions, so be ready to share every little detail you noticed. Step 2, they'll almost certainly want a stool sample to check for parasites. Step 3 is blood work, which gives them a huge amount of info on organ function and hydration. And if they need a better look inside, they'll move to Step 4, imaging, like X-rays or an ultrasound, to hunt for things like blockages or tumors.
Once they have a diagnosis or at least a really good idea of what's going on, they can start treatment. And it's so important to remember this. There is no single magic pill here. The treatment plan is going to be completely tailored to whatever is causing your dog's issue.
So what might that treatment look like? Well, IV fluids are really common to get them rehydrated. They might get antibiotics or dewormers, maybe some medication to soothe and protect the stomach lining. A bland diet like plain boiled chicken and rice is almost always part of the plan for a little while to let their system rest. And of course, in more serious cases, like if they swallowed something they shouldn't have, surgery might be needed. Look, if you take away just one single thing from all this, let it be this quote: "Time is everything. The sooner treatment starts, the better the chance of a good recovery." It's really that simple. You noticing the problem and acting fast are the most important part of that equation. When it comes down to it, you are your dog's #1 advocate. This information is here to empower you, but your vet is your essential partner. So that leaves us with one last thought. In an emergency, every second counts. Having your dog's health history ready to go for your vet can be a literal lifesaver. So, is yours ready?